Three.
I am Nicholas Kukeme, and today we are discussing about physician burnout and what is it. And in the healthcare environment, physicians deal with it is packed with workdays, demanding pace, time pressure, and emotional intensity can put physicians and other clinicians at high risk for burnout. And burnout is a long-term stress reaction marked by emotional exhaustion, depersonalization, and lack of sense of personal accomplishment.
So the first thing that we thought about when it came to physician burnout was the importance of empathy that a doctor must maintain throughout the course of their career. And according to Patient Engagement, which is a website that kind of deals with quality of care, it says that there's so much administrative work that goes into healthcare today that their doctors have lost the empathetic side that's needed for quality care. It also says the doctor spends over half of his day inserting information into the electronic health record, which is over 6 hours a day, which is kind of crazy. So John Cullen, who is a doctor and he's also a president of the American Academy of Family Physicians, says that one of the causative factors of burnout is a type of depersonalization where one has difficulty reaching to patients with as much empathy as they need, and there's a certain connect between physician-patient care and quality care that helps improve the patient's overall experience at the office as well as their healthcare in general. He suggests that doctors throughout the day take self-care and self-reflection. So he mentioned washing hands in between patients, use that as mindfulness activity, and that kind of helps cleanse the mind from the previous patient when you move on to the next patient.
Once physician burnout has set in, therapeutic solutions are the best interventions. One therapeutic intervention that has been proven successful for multiple careers is peer discussion/support groups. Most psychiatrists, therapists, and counselors participate in peer support groups to help manage their client/caseload in order to help them de-stress from the burdens they carry home from their patients. When you're so involved in a patient's life, you know that you really truly do hold many aspects of their well-being in your hands. So why are a majority of physicians not participating in a similar support group? Think about when you've had a really long, hard day of classes or work, traffic was terrible on top of all of it, and you feel as though your brain is about to burst from being so active. Don't you feel better once you've vented to someone about all those numerous stressors? It feels as if a weight is lifted off your shoulders. If this technique helps everyday people like us, it can certainly help the professional healthcare providers who have people's lives in their hands every day.
Another reason physician burnout is occurring is due to the amount of use of technology in documenting. For every hour of patient care, doctors are having to do 2 hours of administrative work behind the scenes. Doctors are blaming it on the increase of electronic health records. According to Patient Engagement, the computer has literally and figuratively gotten in between the physician and the patient, hurting patient satisfaction. Dr. Collins states that doctors are too focused on documenting and missing out on the patient-centered care and patient interactions. That it is even a possibility that they could miss an important part of the patient's diagnosis or clinical care. Although people are beginning to recognize the issue of the electronic documentation, there's still a lot of room for improvement, specifically with electronic health records. That is the fundamental problem in the industry. Currently, doctors spend 10 minutes looking around the electronic medical record for information. There is no clear way of finding information, which takes away from the attention of the patient. Dr. Collins suggests that the EHR needs to be more hands-off with a voice-enabled technology that could document for the provider. In the end, technology and the amount of documentation is becoming a real conflict for doctors and their patients.
Yeah. In conclusion, efforts to address the physician burnout problem are being dealt with. Ultimately, These solutions need to focus on putting patient care at the center attention. Reducing physicians' burnout will require allowing doctors to do what they do best, treating patients.